kidney. Now, this is the three-part kidney. What you're looking for in this part of the kidney is we're going to do the circulation of blood. So we're going to start off with the renal artery, and that's followed by the segmental artery, which is followed by the interlobar artery, and then the one that's moved like an arc, like that, that is the arcuate artery. And then do you see all these tiny little arteries up at the top? Those are interlobular arteries. Okay? Same thing with the veins. We have interlobular veins, followed by arcuate veins, followed by interlobar veins, and then the interlobar vein goes directly to the renal vein. Okay? And then we have the same thing that we saw in the other kidney model, which is the outer cortex versus the inner medulla. We have renal columns between the renal pyramids. These are the renal pyramids. Okay, these are the minor calyces. These are the major calyces.
What major is that?
Right here. And then this would be, the ureter.
Which one's the renal columns?
Between the pyramids.
Okay.
The cortical tissue between the pyramids. Okay? Now we're going to take one pyramid and blow it up, and this is what you see. So this would be the cortex. This would be the medulla. Okay? Do you see all these bubbles here?
Uh-huh.
Those are the renal corpuscles. So on the inside, you have the glomerulus, and then the cup on the outside is Bowman's capsule. Okay? The tube now this whole thing is a nephron. Just like this whole thing is a nephron. Yes?
Yes.
Okay, now you want to know the different segments of the nephron. So we have the part that's connected to the renal corpuscle. So that would be the proximal convoluted tubule, or the PCT. Okay? From there we have the descending limb of the loop of Henle. And you have to say the descending limb of the loop of Henle. Then there's the ascending limb of the loop of Henle. At the end of the ascending limb, we have the distal convoluted tubule. How do we know the difference? The distal convoluted tubule is connected to this large structure, and this large structure is what? The collecting duct. Okay? So whether you're looking at this nephron or this nephron, the part that's connected to the renal corpuscle is known as the distal tubule, the PCT, and the part that's connected to the collecting duct is the DCT. Okay? Now, do you see this region here? This vein, this artery-like structure? That's your vasa recta. That's the vasa recta. Okay? Any questions?